My own opinion about why majority of IVF failed. What I found out, my observation about IVF, because as much as possible, technology is advancing. Then, if there's a problem, these day passing that professionals are enhancing their practice by acquiring a new skill, then we should be able to overcome a particular problem that is occurring every time. My own opinion about IVF, I found out that majority of women that they are on IVF treatment don't take fertility supplement to treat their body. Me, I want to believe that because it is technology, the procedure is technology. Majority of we professionals, we believe that because a woman could not get pregnant naturally, technology will assist. That is why they call it assisted reproductive technology. But let's look at it this way. Ovaries of a woman play a major role in controlling the system, especially the womb, to support pregnancy. For any woman that is above 35 to 40 or close to 50, they can do IVF procedure for them to achieve their desired result of having baby. But look at it this way. When you do LH and FSH, and LH and FSH is too high, it means the ovaries are failed. That means the functions of the ovary to control the system may not be there again. And now we want to do IVF. After the transfer of embryo, for some of you that have done IVF before, they will give you progesterone injection, they give you progenova, they will give you prednisolone, they will give you aspirin, and they will give you cyclogens. All this is to ensure that the receptivity of your womb is being prepared so that when the embryo is transferred to your body, your womb will be able to take that embryo and start germinating it. Take that embryo and the implantation process will start. One of the works of ovaries is to ensure that enough progesterone is produced for the endometrium to be vascularized so that implantation can take place. In other words, for women that are older in age, when their ovary could not be functioning as expected, those things they will give them after the embryo transfer is to take the function of the ovary by making endometrium to support the embryo. So, in my own opinion, even if a woman that is above 45 is taking IVF, that patient needs to do LH and FSH in order to find out if the ovary has failed completely. Then treatment could be done to reduce the activities of the diminishing ovaries so that at least when a lot of neutral field support is given after the embryo transfer, the ovary to a certain level will coordinate the system. In my own opinion, every woman that is taking IVF procedure need to take fertility supplement. I've seen so many professionals, they do IVF procedure without giving patient any drug to take because they believe it is a technology procedure. I would advise, if you are doing IVF, whether you are 50, you are 40, you are 35, please prepare your body. Even if they are not giving you this supplement in the hospital you are attending, you can buy yourself. You can buy something like FERTILITY, you start taking them to prepare your body. Even if you are not using your egg for IVF procedure, FERTILITY could be given to you, or any other supplement could be given to you to prepare your endometrium so that you can receive the embryo. In my own opinion, I believe that maybe because majority of women accessing IVF procedure, they don't treat their body, they don't treat their womb before that procedure starts. What they give them, just give them some drop Levofem, so for them to see their period and the procedure will start. I advise, in my own opinion, that every woman should please buy fertility supplements, prepare your body for IVF procedure, even if you are not menstruating and you want to do IVF procedure. I believe the rate of failure will reduce. My name is Roger Adekende Samuel. I'm a practicing fertility scientist, a brand ambassador for FERTILITY. Till I come your way next time, God is good. Bye.